Hi everybody, welcome back to my channel. This is part 3 of RA, or Rheumatoid Arthritis. So if you haven't watched part 1 or part 2, then I would recommend going back and watching that first before you watch this video. Otherwise this one probably won't make a whole lot of sense. Part 1 was about symptoms and trial and error and diagnosis. And then I think I even got started on talking about prednisone, one of the first medications prescribed for rheumatoid arthritis in that video. And then part 2 was more about methotrexate, folic acid, kind of the positives and the negatives and how they help and some side effects. Now I want to start this off by saying that even though these medications were not for me, like they were prescribed for me, but even though I decided that these medications were not for me and I didn't want to do them because I didn't think the negative was worth it, for some people it is. For some people it really, really is, because they do a lot of good too. And sometimes when you're fighting something really, really nasty like cancer, which some of these medications are prescribed for, or rheumatoid arthritis, a completely different type of illness, but both affect the immune system. Sometimes you need something really nasty in order to battle that. So I don't want you guys to just take my word for it or go based off of just what I'm saying. Seek out a professional. Talk to your doctor, get referred to a specialist, a rheumatologist, and really make sure that you do your homework, your research. So with that being said, I'm going to go ahead and jump in, because just like in part 2, I tried to do this recording and I talked too much and everything, or talked too long and everything crashed and I lost all the work and I had to start over. Well, that happened again. This is the second time that I've tried to record part 3, so I'm just going to try to be quick. I want to be detailed, I want to be informative, but I really want to be quick too, because I don't want to start over again. Just to recap really quick, not in detail, just a quick recap. The methotrexate, or Trexol, is a DMARD, D-M-A-R-D. That stands for disease-modifying anti-rheumatic drug. It stops cell growth, it's an immunosuppressive, and a chemotherapy. It's used for many cancers and RA. It is one of the first ones that was utilized for RA. Although they use it in a lot of cancer treatments, it can also cause cancer. It takes 3 months to start working effectively in your system, to build up enough to actually have some really noticeable change. It has side effects like fever, chills, tiredness, unwell feeling, mouth sores, upset stomach, vomiting, nausea, dizziness, abnormal liver function, lung infection, hair loss, depletes folic acid, and can cause anemia, which is again why in the last video I talked about being prescribed folic acid as well, to kind of make up for that, because the folic acid helps with, it's a vitamin, it's used to produce and maintain new cells. It helps with red blood cell formation and utilized a lot in pregnancy. It's a really, really, really big thing. So they use it for individuals with anemia or folate deficiency, a vitamin B12 deficiency, Rett syndrome, celiac disease. But it has a lot of side effects as well, like if you take too much, because anything, whether it's a bad thing or a good thing, too much of anything can be a bad thing. Ooh, couldn't get that out for a second. So it has side effects like skin rash, abdominal cramps, diarrhea, confusion, irritability, seizures, nausea, gas and bloating, poor appetite, funny taste in the mouth, trouble sleeping, and overly excited or easily depressed. So that's just a super quick recap. If you want a lot more detail on what I went through and what I didn't, and how I felt and my thoughts on it, go back to the other videos. That one's in part 2. So anyways, moving on now, so I can try to be quick with this. And if you have any questions, if I'm too quick and I'm not thorough enough and you have any questions, leave a comment. I will check the comments. I will get back to you. So if the methotrexate, after taking it for like 8 weeks and it's not working appropriately, and they decide to up the milligrammage or the dosage, and they give that another 8 weeks and it's still not working, they might decide to go ahead and put you on it's 3 different types of DMARDs combined in your regimen. DMARD, remember, D-M-A-R-D, disease-modifying anti-rheumatic drug. These are the heavy hitter medications. They're all used in cancer treatments. So the next one after methotrexate or Trexol is hydroxychloroquine or Plaquenil, which is also a DMARD, but it confuses your cells. They use it to regulate your immune system. It was typically used for malaria patients or patients with lupus, autoimmune disorders, and utilized in chemo, and it's also used for RA, which, by the way, happens to be an autoimmune thing. No surprise there. So this particular one takes anywhere from 1 to 3 months to start having noticeable effects. So like most DMARDs, you have to take them for a while before they start doing enough good in your system or in your body to really notice it. And that's why that one of the first things that they prescribe, which I talked about in part 1, is prednisone, because although prednisone can be a lot worse for your body in the long run if you're using it as a long-term medication, it delivers immediate results. It's not the end-all be-all. It doesn't fix everything, but it helps a lot. Even with all the nasty side effects, it helps a lot, and it helps quickly. So that's why they put you on that, and then you have to take time with the others while you're on the prednisone, just to kind of see how it's doing, what works for you, if it's going to work. Because if they try all this and after all this time it still doesn't work, then they're going to have to put you on something else too. And there are many, many other kinds of medications that they could try, which are just as effective. Like, they're all effective, but just who they're effective with is the issue, because not the one that works for one person won't necessarily work for another. So they are effective. It just depends on the person who's taking them. So they have a lot that can be tried, and it's all trial and error. So the hydroxychloroquine has side effects of headache, dizziness, nausea, vomiting, stomach pain, mood change, hair loss. Are we seeing a pattern here? Because most of these pills or medications that I've been talking about cause a lot of the same thing. And if you're taking just one, then yeah, it might not be so bad. But when you're taking multiple pills every single day, multiple pills every single day, and all of these pills have a lot of different side effects, but all of them have a few common side effects as well. It's like you're getting hit double, triple, quadruple on the same side effects. And there were days, heck, there were weeks where I couldn't pull myself off the bathroom floor. You know, you take these medications so you can have better quality of life and be able to grab things and function and brush your own teeth and wipe your own bottom when you go to the bathroom, because believe me, at some point that's going to go too. So you take these medications so you can have some kind of quality of life, And then they cause a quality of life where, yeah, you can grab things, you can wipe your own bottom and wash your hands and brush your own teeth and brush your own hair and grip the steering wheel to drive your own car, but sometimes, or a lot of times, you're just physically too ill to do it. Vision loss. Again, with the vision, this is not the first one that has vision issues as a side effect. And I don't remember if it was part 1 or part 2, but I talked about I think it was part 1. I talked about how difficult driving became just because of the vision issues, and how scary that was, and how I had to stop for a while because I was afraid I was going to hurt someone. I was going to hurt myself. I was going to hurt a kid. I was going to hurt an animal. I don't know. I was going to hurt somebody. And that's too much for me. So I had to make a conscious decision between quality of life for me and what that means for me. And that's the same thing you're going to have to do. For some people, they don't have the same type of side effects, or they're not as severe, or they are severe, but it's different ones. And it's worth it to them. So, skin spots. And I definitely have skin spots. And I don't know if you can see it out here. Oh, yeah. Like, right there. See all these? And I actually have makeup on, not a bunch, because I don't wear a lot of makeup. I'm not really big on it. I'm bigger on skincare rather than makeup, and you can see these through the makeup. So these little dark spots here, there's a glare so I can't tell, but I have them in here, down in here. I've got them over in here. I've got them all over the place, really, and that's not just because this medication can cause skin spots. I mean, it can just straight out cause spots like that. But these medications also make you really sensitive, your skin really sensitive to the sun. So before, when I would go out in the sun and I would spend an hour or 2 out there playing with my kids, after starting all these pills, I would go out there for 10 minutes, and after 10 minutes, I would be burning. And not just like my skin's burnt, because sometimes you can go out and you can be in the sun and your skin gets burnt, but you don't realize it until it's kind of too late. It's not like that at all. You literally feel your skin burning, and you're like watching the clock like, okay, yeah, I don't mean to cut you short, kids, but you got to show me what you're wanting to show me now, because I got to get back inside because my skin is on fire. Again, quality of life, because now you're short with the kids because your body's on fire. Every area that the sun is touching hurts. So, it just depends. I mean, you can wear a big hat with a big brim or something, like a sun hat, and make sure you wear long sleeves even when it's hot out. And, they make long sleeves that are very light material and flowy, so you can still have air movement, and they've got moisture wicking and all kinds of stuff. So as long as you are prepared, it's not really that much of an issue. But I wasn't going to go out and spend money on a whole new wardrobe for summer, and I certainly wasn't going to put my winter clothes on, so I didn't get to do much outside. And then when I did do stuff outside, I paid for it. But again, that's cosmetic. That's, I mean, if you're vain and you're worried about these spots popping up, for some people that's really important. For me, not so much. I don't really, I want to be healthy. I don't necessarily worry about what I look like. If you don't like how I look, you don't have to look at me. That's kind of the way I see it. I like me. So, okay, so moving on. Sorry, it's bright out here. Moving on from the hydroxychloroquine, which, oh, by the way, sorry, can also cause weight gain or loss. I don't get that. I understand the weight loss because you're getting sick all the time. I don't understand the weight gain unless it's kind of like the prednisone where it makes you retain water. I'm not sure on that particular one. So the The next thing that they put you on with the methotrexate and the hydroxychloroquine is sulfasalazine, also a DMARD, anti-inflammatory, immunosuppressive. I already talked about what immunosuppressive and all that means in the previous videos. So again, if you haven't watched those first, even though they're all long, I'm sorry, I would still recommend going back and watching them. Excuse me. Sulfasalazine is typically used for like ulcerative colitis, chemo drug, and rheumatoid arthritis. And just like the hydroxychloroquine, it takes anywhere from 1 to 3 months to start effectively working, having noticeable results. Side effects. Here we go. Remember I said, is it starting to sound like a theme here? Upset stomach, nausea, vomiting, headache, loss of appetite, dizziness, unusual tiredness, depression, hair loss. I mean, all the same things over and over and over again. This one has another one. Urine and skin color change, or yeah, your color of your urine and your skin can change, and the smell of your urine and the smell of your skin can change. The smell just becomes stronger. Everybody has some kind of odor when they go pee. It's usually too faint to notice, but it's there. I mean, they're chemicals that your body makes. It's chemicals. So all chemicals have, like, except like some gases have, like, even just a little tiny bit of smell. Most of the time you can't smell it, just because it's so faint. You just can't, which is a good thing, because nobody likes to smell stuff like that. Nobody likes to smell anything that doesn't smell good, but this stuff will make the smell strong, so you can and do smell it. Your skin, I don't even know how to describe the smell that comes off of your skin. It's almost like, because the pores in your body secrete toxins and chemicals out of your system, and typically you can't smell that either, just like you don't really smell urine when you go to the bathroom. But now, as it comes out, when you take those medications, or when you take the sulfasalazine in particular, as a side effect, you probably will. Not everybody does, but it's likely. And it's not a super strong smell, but it is enough to make you want to wear a little body powder or something like that. So, the color, your urine will become very, very dark. Very dark yellow or almost orangish. Marley, stop it. Stop it. Baby girl, just stop it. Your urine will become very, very dark. Dark yellow, almost orangish. It's normal. It seems weird as heck, but it's normal. It doesn't really do anything, and who the heck is going to see it but you? The color of your skin can become, you can get patchy spots, kind of like my brown spots up here, only they're yellowy, I guess, and some of it can seem a little more translucent or thin. So just be aware of that. All right, and then moving on. So that's the duo, or the triple, not duo, that's two. The triple of the methotrexate, hydroxychloroquine, and the sulfasalazine. They tell you that while you're taking all these medications, if you're still having symptoms, you're still having problems that these medications are not taking care of, that you can take naproxen, or basically Aleve. Naproxen is Aleve, over-the-counter Aleve. It's an NSAID, so it's a non-steroidal anti-inflammatory. That's what NSAID means, non-steroidal anti-inflammatory. It does help. It's kind of like taking ibuprofen, only stronger. But if you want to take something else, you have to talk to the rheumatologist first. You have to talk to them, because a lot of medications will interact with these medications that they have you on, and that is bad. Bad, bad, bad. Some really bad things can happen. Even with the naproxen, which is typically used for fever, inflammation, and pain, just the normal stuff that you would go get ibuprofen or Tylenol or things like that for. Takes 1 to 3 hours to start working in your system effectively, so it's pretty quick, but it also has some nasty side effects, especially for very long-term use. So let's go through some of those side effects. Indigestion, heartburn, stomach pain, nausea, headache, dizziness, drowsiness, bruising, very easy bruising, sometimes not even knowing how you got bruises. I came home with bruises on my hand where I didn't even bump it. I don't know how it happened. It just appeared. People thought I was getting beat up at home, which is ridiculous. For me, for my case, for my home life. Just itching, rash, swelling. Now we're taking all this stuff to get rid of swelling, and that's a few different things now that cause swelling. So I don't know, just kind of weird. Ringing in ears, weight gain. I don't know how naproxen or Aleve correlates to weight gain. I didn't check into that. I just knew that after all of these side effects, I had enough. Abnormal liver function. With all these meds, that's to be expected for liver function to be abnormal. Just need to keep an eye on that, because that can be a really bad thing. Again, they have you come in and test you over and over and over again all the time, so they can keep track of all these different things that could potentially become very serious matters. That way they can stop it before it gets there, hopefully. Rash, constipation, bleeding, blurred vision. There we go with the vision again. Skin blotches. There we go with the skin blotches again. Diarrhea, excessive sweating, hearing loss, heart pounding, heart failure, feeling faint, fever, and depression. Like, there is a theme going on here. There really is. Because all of these things have a lot of the same thing. I mean, you go back to the prednisone, you're looking at muscle pain, cramps, hair growing in weird places that you don't normally get hair, like on your chest if you're a girl, or on your face if you're a girl, irregular heartbeat, weakness, memory impairment, swelling, hands, ankles, feet, hair loss, unusual weight gain, infection, fever, persistent sore throat, vision problems again, vomit that looks like coffee grounds, bone weakness, anger, depression, insomnia. I mean, I experienced a lot of these. I had a lot of side effects, and I couldn't necessarily tell you which ones came from which medications, except for the ones that started taking place when I was only on a couple medications, because when they first started me off, they started me off just on the prednisone while they were doing all these tests. That way I could at least get some kind of relief while they were doing all these tests to figure out what kind it is, how bad it is, where it's the worst at, what they really need to focus on, and then kind of go into a plan of action from there. Excuse me. So, and then when I was on the prednisone, I was also on Aleve, and I was also on like folic acid, and but not any of the real heavy hitters yet, so darn it. Alright, I'm sorry about that, excuse me. So, I was also prescribed gabapentin or Graylese. This wasn't for the RA, it was for one of the symptoms of the RA. Like, the RA had done so much, like, had caused nerve damage, just because if you watched part 1, you'll know I had it for a very long time before knowing that I actually had it, because nobody diagnosed it. And when I was feeling awful, that's not what they were looking for, and when I wasn't feeling awful, nobody was looking for anything because nothing was going on, back before it became constant and severe. So after having it for so long, it's caused nerve damage, and they prescribed me gabapentin for that nerve damage. Gabapentin or Graylese helps with nerve pain. It's an anticonvulsant. It was originally created for seizures, but it's also used for anxiety and RLS, and of course symptoms of RA, or symptoms of nerve damage, or I guess nerve damage, period, nerve damage. because it's used for nerve pain. This takes about 1 to 2 weeks to start working, and this was pretty important for me because, or a pretty big one for me because I was having issues with dropping things and severe pain, shooting up and down my arm, down into my hands, all the way down into my fingertips, up through my shoulder, my elbow. Felt like it was in the bones, in the joints, in the cartilage, in the tendons, like all over the place. I couldn't sleep right, I couldn't function appropriately, I couldn't do my job appropriately, couldn't really type appropriately, just all kinds of problems. This said, darn it. Excuse me 1 second, I'm sorry, I need to get a drink. My throat is very, very dry. Oh, okay. Much better. So, Marley, no. So, they said it would take 1 to 2 weeks for this to start taking effect in the system appropriately to really notice a difference. I noticed a difference in 24 hours. That's all it took. And I'm telling you, I've been a migraine sufferer since I was super little. Like not even old enough to have prescription medications really for migraines. And that's not why I was taking this medication. That's not why it was prescribed to me. But it helped. It was amazing. I had the most relief I have ever had in my life from my migraines from this medication. As far as the nerve pain in my arms and my hands, my shoulders, it helped a lot. That took a couple more days. It took a couple more days. But a couple more days, we're talking like 3 days total since I started taking it. And they told me it was going to be 1 to 2 weeks. No, I had immediate results. But side effects, weakened muscles. We've heard that one before on other medications. Respiratory problems. We've heard that one before on other medications. Memory loss. We've heard that one before. Uncontrolled eye movement. Now that was really weird because I would have issues with like, and I don't mean just like the eyelid twitching or the under eyelid twitching. I've had that off and on. Tons of people have had that off and on. I wouldn't really consider it a problem because it's not something that happens all the time. Like it's happened a couple of times here and there throughout my life. When I was taking this medication, it happened all the time. Like, and not just back here, like the whole thing. And I would have my eyes open and just feel this going on, and just, it was kind of creepy. It was annoying. It wasn't a huge problem. It was annoying. Now, when my eyeball would literally twitch and that would mess with my vision a little bit, that was a problem. Clumsiness and unsteadiness. I am already clumsy. A lot of these medications cause unsteadiness, dizziness, clumsiness. I was a walking hazard. Again, as long as I'm walking around, not a big issue. I mean, I'm not going to hurt someone. I'm not going to like fall out into a street and cause myself to get hit by a car on accident, and then that person end up going to jail for something they didn't even really do because it wasn't their fault because I'm on these medications. Like, it's not that bad, but yeah, I was bumping into stuff all the time, plopping down when I would go to sit because I wouldn't be able to control, because I felt too weak. I wouldn't be able to control how hard I was sitting down, so I would just plop on stuff. I would fall over, I'd bump into things, I'd spill things, I'd drop things. Some of that seems like part of the reason why I was taking these medications in the first place. Not this one in particular, but, well, yeah, even this one, but I don't know, I guess you just gotta weigh the pros and cons of what's most important to you. So, then we got constipation, diarrhea, difficulty speaking. Difficulty speaking, that was a hard one because I knew what I wanted to say, but for some reason there was a misfire, it wasn't connecting and it wasn't coming out here. And it was really frustrating because I'd be trying to say something and it's not like when, you know, that phrase where you say, well, it's on the tip of my tongue, but I just can't remember what it is. Like, there's something I remember that I want to tell you, but what was that word called, or what was the name of that product? It's in there somewhere. It's not like that at all. You know exactly what you want to say. You can hear the words going on inside your head, and you cannot make them come out of your mouth. Or you can make a couple of them come out of your mouth, but not in the right order. So if I wanted to say not in the right order, I might say right not. That's not helpful. Like, nobody knows what you're talking about. You know what you're talking about, but you can't get it to come out. So a lot of times you have to write down what you're thinking and then kind of read it back. It's weird. Okay, so drowsiness, tiredness. Heard that one already. So many that are exactly the same. Dry mouth, headache, poor concentration, nausea, weight gain. There we go again. Vomiting. Vomiting and weight gain. Like, if you're vomiting and you've got diarrhea going on and you have excessive sweat, so you've got everything leaving your system between the diarrhea, the vomiting, and the sweat, and loss of appetite, so you're not taking anything in, how are you gaining weight? You're retaining water. From what I'm not sure. Double vision, muscle aches. It can cause you to not be aroused. Like, there's a reduction in your arousal ability. Okay, well, if I'm in the bathroom having diarrhea and throwing up in a bucket at the same time, I don't think I can get aroused that way anyways. So, you know. Headache, poor concentration. I think I already said those. So yeah, just a lot of nasty things. I didn't experience all of these. I experienced a lot of these symptoms or side effects on all of these medications, but I didn't experience all of them. And it's different for everybody, and I've said that a lot, but I just want to point that out again. Now, that was not good quality of life for me, so I chose not to do any of those medications anymore. I quit all of them, everything. And yeah, you might be thinking, well, why would you do that? Because then all of that pain and swelling and aching and nerve damage and loss of function, all that stuff comes back, and it does. It does. But at least I'm coherent. And I can look at things besides the inside of a toilet. So, Marley. My goodness. Okay, so what I have started on, and I didn't start it right away. I didn't make a plan like, oh, I'm going to stop doing these and I'm going to start doing this. But so I went without anything for a while, and then I made a decision to start CBD. CBD, yes, it does come from marijuana plant, hemp plant, but it is not the THC. There is no psychoactive compound in it. It does not get you high or stoned or whatever you want to call that. It doesn't do that, which is a good thing, because I wouldn't take it if it did. Like you've heard me mention before, when it came to narcotics, like the Oxycontin and stuff like that, that was prescribed to me, that I didn't take, that I didn't want to take. I don't like feeling like I'm not in control of my own body and my own functions. Even with the RA, when I can't do something because of the pain, I'm still in control of the amount of pain I'm taking. Like, I'm going to do this until it hurts to this point, and then I'm stopping. I'm still in control. So if I wasn't in control, I wouldn't do it. So that's why I went with CBD, because it doesn't have that psychoactive property. It's organic, terpene-rich CBD hemp oil. It's natural plant-based cannabinoid used for, now, are you ready? Pain relief, sciatica nerve, inflammation, multiple sclerosis, RA or rheumatoid arthritis, that's 5, going on to 6 here, anxiety, depression, cancer-related symptoms, acne, I'm not sure how on that, neuroprotective properties. It has neuroprotective properties. That's 10. Okay, moving on. Used in high blood pressure, heart health. That's 12. That's 12 things. And there's actually a really, really, really huge list. I just figured you'd get the point from that, and I stopped there. Side effects. Side effects are not common. Not common. Like if you were using THC, I'm sure there'd be a lot more side effects. CBD only has a few, and they are not common. Doesn't mean they can't happen, it's just not likely. Diarrhea. Well, if all those other medications were giving me as much diarrhea as they were, I think I could handle one medication where it's possible but not likely. Fatigue. Same thing. If all those other medications were making me tired and drained and weak and dizzy and tired, you know, like, I think I could handle one, again, where it says it's possible but not likely. And appetite change. Well, again, all those other medications really, really damaged my appetite, so I wasn't concerned with that. CBD interacts with two receptors that you have in your body, the CB1 and CB2, to reduce pain and inflammation. The CB2 works with the immune system, which RA is an immune system thing, so that's kind of why CBD is used in some RA treatments. Now, here's something that I want to point out. All those other medications combined prescribed by the doctor cannot stop the progression of this disease. Cannot do it. It can slow it down. Doesn't mean it will slow it down, but it does work for a lot of people. It can slow it down, but it cannot stop it. CBD, there have been studies done. There's research done by doctors, research journals by doctors that show results where individuals actually had their disease stopped. Like, it, not everybody, you know, not a high percentage of people, but it's a possibility that it slows it down so much that it will actually stop it. Now, if you stop taking the CBD, I don't know if that means that it'll come back or it'll start up again. I'm assuming it will. I haven't seen research on that yet, so don't take my word for it. Do the research yourself. Look around. You can find it anywhere, in the news, on the internet, from doctors, literally anywhere. But just know that that's a possibility. So the ones that I'm taking, there's a couple of different options, because the ones that I'm taking, I've got the capsules and I've got the hand cream, and these are considered, or the topical, not hand cream, but topical. These are considered the large jars, and they are pretty big and they do last a while. But the large ones where I go through, it's $109.99. But they have this care program. If you go online to American Shaman and you go to their care program, if you have RA, you've been diagnosed, or some other like debilitating disease, you fill out an application for their care program and upload proof that you have this disease. You don't need a whole lot of, I mean, you just need a doctor's statement saying that you have this, and you'll get a discount for life. The smaller ones, which is like half a month's supply, is $59.99. Actually, the cream lasts quite a while. The half a month's supply is on the pills, because they say you should take them twice a day. Once in the morning and once at night. So let me read this to you real quick. CBD American Shaman Capsules 900 Ultra Concentrated CBD Hemp Oil Daily Dietary Supplement. Organic hemp CO2 extract in a capsule. Highest quality hemp oil available. Terpene rich, full spectrum. 60 capsules. 900 milligrams of CBD per container equals 15 milligrams CBD per capsule. So not much. Other ingredients. Medium chain triglyceride oil, naturally extracted from coconut oil. Vegetarian capsules, which are the capsules that is actually in. Vegetable cellulose, purified water, silica. Okay, so here is that. And then other ingredients. And then suggested use, 2 capsules daily, 1 capsule in the morning and 1 in the evening. It says CBD American Shaman uses the highest quality hemp oil available containing high amounts of CBD cannabidiol, 100% natural pure CO2 extract. It's 100% organic, non-GMO hemp and has no heavy metals or insecticides. Batch tested using ultra performance convergence chromatography. We use certified organic ingredients. Well, come on, camera. I know, it's hard to read while I'm moving it. And this is what these look like. Because you can get it in like oils that you can put under your tongue or all kinds of stuff, and I just think that would taste nasty. I don't know. So okay, I'll close that in a second. But this is literally, this is it. And you can see the oil in there. That's all it is like a little oil. And you take 1 in the morning and 1 at night. That's it, just this tiny little thing. And then the other thing I use, so I have it coming from the inside and the outside at the same time, just because I figure that's going to be better than one or the other. And I figure if I can handle taking all those other meds, then I can handle doing this. CBD American Shaman, 100% organic, terpene-rich, ultra-concentrated CBD hemp oil, 500 topical cream. This is 2 fluid ounces or 60 milliliters. There's 250 milligrams CBD per fluid ounce in this container. Now, this it says proprietary nanotechnology, nature enhanced by science. Now, the reason I bring that up is because most CBD it's an oil. It's oil soluble, and when it's oil soluble, it's harder to get into your system. Like, you can take a dose, and you might be getting a third of what you're actually taking, because only a third of it can actually absorb. So you may be taking a high milligramage or a high dosage, but you're not getting that much. So, excuse me, I'm sorry. So this, the proprietary nanotechnology has actually made it so the CBD in here is water soluble. So your body can absorb all of it. That way you get the full dose. And it says ingredients: vegetable glycerin, lanolin, aloe vera gel, DMSO, terpene-rich hemp, oil concentrate, vitamin A, vitamin D, vitamin E oil. But it's creamy, never greasy. Proudly made in the USA. And then, directions. Use a drop or 2 of our 500 topical cream. A small amount spreads like crazy. Pat onto affected area and see a difference in a matter of days. Nature's secret is at your fingertips. Research shows nanotechnology is more bioavailable, has faster absorption, and lasts longer in the body than oil. And then in really fine print, natural ingredients may cause color variations. And I have noticed that, like the cream in here. This one's white. I don't know if you can see that. Probably not. Well, okay, so this one's white. When I first got it, it had no smell at all. After it sits for a while, like this one does have a little bit of a planty smell, which I'm not fond of. But once you put it on, I think that's just because it's all in one container, sealed, and because when it comes out, it's not really like that. Now, I have had some where when it sat for a little bit, it wasn't white anymore. It had a little bit of a greenish, like very, very, very light green tinge, like those up there, those leaves right there behind me, only lighter, or yellowish. That's because it comes from a plant. It comes from a plant. So I'm just going to take a little bit out of here, and really, like, this is a super, like, here's my pinky. See this? This is a super tiny spoon. It's just a tiny spoon that's used in skincare. Okay, you can get it virtually anywhere. It does not come with the cream. Most people just stick their hands in there. I don't like to do that. This is more than I need. See this tiny little bit right here? This tiny little bit right here. See how little that is? That's more than I need. And it spreads like crazy. And it is creamy, not greasy. And it absorbs in super quick. Okay? So, there you go. Got this little bit. Okay? Maybe now you can see it's white. The color may be off a little bit. It's still exactly the same. And now that it's out of the jar, no smell. So, all we do is pat it around, and then I just take it. I don't try to get everything. I grab it and I put it over the areas where I hurt the most that day, because that can change. That can even be, you know, up in my elbow. I can have it up back in my shoulder. I might need help getting it put on, in which case I wouldn't be wearing a sweater. A lot of times I get it down in, like, my wrists get so bad, and then that's it. That's all you do. And then if there's anything left over, just smooth it in. It makes your skin feel amazing. And that's really it. And then it's not greasy. It feels a little slippery at first. But you give it a minute, and that will go away. Like, literally. Good. And that's what I do. And I've noticed a huge difference. It still hurts. It still swells. It's still achy. There's still pain. It's just more bearable for me. It's more bearable. So am I willing to live with some pain forever and be able to function and not be stuck on my bathroom floor? Yes, I am. That's my choice, you know? And this, just like all other RA medications, this may work for some people and not others. Just like the other medications that the doctor prescribes. Who knows why one works for one person and not another person? They don't have an answer to that. So this is the same way. These medications, these over-the-counter supplements, basically, they work for me. They may not for you. I don't know. It's worth a try. Give it, you know, they come in smaller sizes. Get a smaller size, give it a try. If it doesn't work, then, you know, you lost out on a little bit of money, and yeah, that sucks. But if it does work, it's kind of like gambling, you know, just like trial and error with all those medications that the doctor puts you on. That's a gamble. Spending a little bit of money to try something that may work, that if it does work, you can give up all these other medications that make you debilitated in some other way. That's a huge reward. It's a gamble, but it's a huge reward. It's a huge payoff. It's the jackpot for us RA sufferers. So, you know, if you're tired of how those medications make you feel, give it a try. If you've never been diagnosed, give it a try. This stuff works. Nope, no smell. Just double checking. The CBD works for so many different things. It's so helpful in so many different areas. But research it, research it, research it, research it. Again, just like anything that you put into your body, research it. If you have any questions on any of my videos, please leave a comment. I don't know what I'm going to talk about next time, but I will come up with something. Probably not RA again. It'll probably be something else. But please don't forget to subscribe and like and click the bell for notifications. Please, please, please. All right, and leave a comment. And if you have questions, I will read the comments. I will get back to you. All right? Just not when I'm at work or playing with my kids or cleaning the house. Yeah, I may do it when I'm cleaning the house. Who doesn't like a break from cleaning the house? All right, I'll talk to you guys later.